A great environment means that everyone wants to be there. The patient wants to be there. The team wants to be there. The doctors want to be there. And they want to be there and they love the day for the day. So how do we create that environment? Through communication. We communicate positively with each other. You have to have that mindset, that the team member has to have that mindset that they want to show up to work. They want to show up to work and do good for each other, be 100% accountable, be responsible, and then go home and leave everything at work. So if you have that mindset, everything else is easy, because then they create that environment for each other. And then once they create it for each other, it's naturally created for the patient.
Welcome back to the Dental Economist Show with me, Mike Huffaker. Today, we are excited to welcome Dr. Maryam Beyramian, a distinguished leader in the dental industry. She's the founder and CEO of Westwind Integrated Health, a unique model that integrates dental and medical care under one roof. With a commitment to providing comprehensive care, her organization has grown to 13 practices with over 24 doctors in the Phoenix metro area. She has also recently founded Prime Health Dental in Wisconsin. Dr. Maryam, you've been very busy. It's a pleasure to have you on the show today. How are you doing?
I'm doing great, Mike. Thanks for having me on the show, my fellow Phoenician.
Yes, absolutely. Well, so you are in negative 10 degree weather right now, and this is about as cold as it gets in Phoenix. We're a high of 60 today, but it was very, very chilly last night. So, well, hey, I'm looking forward to the conversation, and I really think that there's a lot that I'm going to learn today, and I always enjoy learning new things. And so, when I first got in dental 5 years or so ago, I heard comments about, kind of the mouth-body connection and integrated health solutions. And I've heard, Steve Thorne talk on some panels at ADSO and Dykema. But I never got a really clear kind of explanation as to what it really means to have an integrated health organization. And so I'd love to hear kind of your viewpoint, your definition, what it means and what the value is that it brings to patients.
I like the way you asked that question, Mike. I haven't been asked that question before. I've always been asked the question of, why is integrated care so important? But I have never been asked the question of, why are we doing it for the community and the team and the office and the practice and the overall healthcare system, the dental healthcare system? So that's a very interesting question. And the reason we want to bring medicine into the dental office, where we want to actually look deeply into the medical diseases of the patient, is to ensure that the oral health care that we deliver them is going to help them long term, right? So that's one aspect. The second reason that we want to bring in some sort of medicine in the dental office is that we already take a comprehensive medical history from the patients, and we are already asking the right questions. If we take it one more step forward, where we not only ask the right questions, but we're able to screen for some of these diseases that maybe the patient doesn't even know they have, we've done a service to the patient. We've diagnosed early disease, right, markers. But we've also done a service to ourselves as dentists and as clinicians, where we're able to tailor the treatment plan to make sure that the patient is healthier at the end of it. So that is the concept of integrated care. And I know you mentioned that you've heard a lot of people talk about it, right? The mouth-body connection. That's what Steve talks about. The oral health is related to your physical health. And, people talk about it a lot. But what it actually means in practice is that the patient that's sitting in your chair, you're able to elevate their service in that chair by a little bit, right? By giving them a little bit more information about their blood panels, about their lipid panels, and give them some tools to help them get healthier on their own.
Yeah, it makes a lot of sense. I mean, ideally, I see my dentist more frequently than I see my primary care physician. That's if I'm in generally good health throughout the course of the year and I don't need to go in for some other things or unexpected things that show up. So it makes a lot of sense with kind of the regular frequency within which people are spending time with their dentist. When you talk about additional screenings or education, is the intent that if I'm a patient, I can come in, I can bring health records, you provide additional information that I would then be equipped to go to my primary care provider and have kind of that knowledge to support my own advocacy for my health? Or am I thinking about this in the wrong way?
No, you're 100% thinking about it in the right way. You're a patient, you come in, and we have a panel of 40 screening markers that we check for you, which includes physical markers, blood markers, social markers, and dental markers. And these are in your own, so in our organization, they're in your private portal. We've created a portal, we've created the system. So you have access to your entire screening medical dental records in this particular portal. And at that point, you know which ones are within range and which ones are out of range, just like as if you went and got a full blood panel done at, a blood bank. So you already know what is in range, what is out of range. All of that is diagnosed, well, not diagnosed, but screened for you in the dental office. So at that point, you can make a decision. Hey, this is important. My health score is, at 82. I need to take care of these 5 factors. And your provider talks to you about that. And you take that information to your own medical provider. We are not filling the medical care gap of seeing you as a medical patient. We used to do that back in 2017, 18, 19. We had primary care providers that you would leave your chair and go to the chair next door and see them. But we found that because we are not able to deliver the rest of the healthcare system to you, right? If you need a referral to the nephrologist or the cardiologist or, whatever the next steps were, we would just refer you and you would just go back out to the medical system. We were not a whole medical network. So we found that it actually chopped up your treatment even more for us to do just that one primary care part and then send you to another medical system. So that's when now we do the screening and you get to see your own medical system.
That makes a lot of sense. That answers a lot of my questions because I was curious about that portion and if you would be able to still kind of deliver the completeness of care at that point that's needed. What I find really intriguing about this is, blood work is something that there can be variance to it over time, depending on the time of day, what your diet is looking like during that particular time, whether you're fasted or not. I think most people you need to fast to do it, but it's not probably taken all that frequently. And there's a lot of arguments, at least that I hear on all these health podcasts that I listen to, that you should be getting your markers checked on a more frequent basis. Do you test for things like T3 and T4 and A1C? And is it kind of a comprehensive panel from that perspective, or are there specific markers related predominantly to oral care that you're more focused on?
Yes and yes, all of the above. So I'm assuming you're asking about the thyroid stimulating hormones, right? The TS. So yes, we do check for those. We check for some inflammatory markers. We check your lipid markers. We check your blood pressure. We check A1. We check 40 different things, right? And we created this panel with collaborations from a network of physicians that collaborated, and we spent a couple of years, honestly, building a panel that makes sense to them. So we would build a panel, send over the information from the patient, and we would get feedback. And so our current panel is the information they need to take your health to the next level, right? If there are markers that are out of range in this particular panel, then they're able to use this panel as information, as a baseline for you so that they can add more testing, add more blood work. In general, if there's something out of range in a blood panel, you don't get treatment immediately. You have to take more panels, see a trend, and then go. So this is your first screening panel for that.
Now, is this billed through health insurance, or is it cash only, or how does that work for your patients?
So we used to bill this through medical insurance and use primary care, codes to bill for it. And if you bill it through their medical insurance and they go back to their primary care, right? We are the primary care, then they go see another medical provider and they want to bill those same codes. They're not able to do that. So again, for the patient, it's much more of a service for us to bill it out of pocket, for them to have it as a screening code where they go into their own medical network and they take this information, give it to them as a baseline, and then they can build their medical portfolio around it, rather than us build the medical insurance and taking that away from their medical network.
What are some of the other challenges in implementing this approach in a practice? Is it additional training related to drawing blood, or are there other kind of elements that, should somebody be listening and going like, this sounds like something that I also would like to be able to offer for my patients, what are some of the things they should be thinking about?
I think the first thing that you need to consider is who am I working with? Who is my team? If you're the dentist that is listening to this podcast and you're saying, hey, this is kind of cool, like I want to be able to provide this service for my patients. Well, first you need to get your team on board and say, hey guys, we're going to bring in a new product, because this is a product. I have it in a system, right? You take it out of the box and it's a product where, there's a step-by-step instructions. There's ways that we train, our team to make it happen, which would be our team, right? But is the team ready for this? Are they going to be on board? Do they understand how to communicate this to the patients, and so that the patients understand the value of what we're bringing up? So that's the first piece. The other pieces are actually pretty easy, because implementing it in is just like bringing another product into your office, like bringing a clear aligner product or a scanner. It's implementing is not as hard as you think it is. It's just making sure that your team is on board to be able to communicate this correctly.
Getting the buy-in is more than half the battle, then, it sounds like. What are some of the objections that a team might have towards wanting to implement this or bring this new product into the practice?
We have a bigger group and everyone is an associate in our group. So there's a big difference between owner doctors and associate. Sometimes the associate doesn't want to implement this level of care for them. So they have to have the buy-in first of, hey, doc, this is why we're doing it. And this is how the patient benefits and this is how the team benefits. So once the doctors are bought in and then the team is bought in, then it's very easy to implement. This is not something that you need to hire somebody from the outside to do. The dental assistant actually does all the blood draws. They are able to do that. This is not whole blood draw. So it's quite easy to implement and easy to execute. So if you're an owner doctor, you're like, I want to bring this into my practice, it's easy. You've already made that decision. You're committed to it. You just need to bring it in.
Are you familiar with, I've been hearing more and more about kind of the oral microbiome tests, where it's like a saliva test and then it presents some type of metric or measure of your overall oral health based off of criteria that I'm not familiar with. Have you implemented any of that technology, thought about it? I'd be curious as kind of what your overall impression is.
So salivary testing has been around for a really long time. And before, it wasn't something that was done in the office. That's called point of care, where you do it now and you get some results now, which is where it is today. But I was doing salivary testing in my offices, 15 years ago, sending it out and getting the breakdown of the bacteria. We do not do that. We do not do salivary testing. And as part of this is salivary testing is a different category. We don't do it as part of the 1+ process. This is called One Medical Dental in our organization. The product is One Medical Dental. And we don't do salivary testing alongside of this, because we are trying to communicate with the physician with this data, right? We're telling the physician what's happening with the patient that's sitting in the chair. The physicians, if they get a salivary, like a saliva breakdown, they don't know what to do with that information. They're like, this is interesting, but it's not blood. I don't understand anything but blood. Send me blood. So that's why we've decided that we're not including any salivary markers in this process, because it doesn't talk to the medical network. we are speaking, we want to incorporate and bring in, integrate medicine with dentistry, then we need to speak the language that they understand, and that's blood.
I see. What are some of the biggest risk factors of poor oral health for kind of the rest of the body? What are some of the links or connections that are out there that maybe people are not as aware of? And I know there's still a lot of research being done on this topic, but what are some of the common ones that you see?
So back to the salivary testing. If we can get salivary testing into the hands of the primary care physicians, where they are doing the salivary testing and checking bacterial levels for the patients, and then telling the patients, hey, this bacteria is hurting your body. It's circulating throughout your body. There's never a good time for you to have loads and loads of bacteria circulating in your body, right? What does that do? It leads to inflammation. Inflammation is the root cause of many autoimmune diseases, right? So the lower the inflammatory markers are in these patients, the lower the bacterial levels are in these patients, the better it is for the patient's medical health, right? So if we can get these salivary tests into the hands of the physicians, that way they can show the patients and then communicate with us that way and send the patients our way, that would be amazing. Our product, our one dental medical product that we do is meant to communicate with them through blood testing, through social testing, everything they understand. I wish that they can do the same for us. And so we can have that bilateral communication between the two of us.
Yeah, absolutely. Are you still the chairwoman of the curriculum of the ADSO?
Yes. Yeah.
And an executive committee board member?
Right. Yes.
Awesome. I would love to hear a little bit, if you don't mind sharing, about what your work with the ADSO entails and kind of what some of the areas that you all are focusing on.
We're very much focused on advocacy, right? We want to make sure that the dentists, the dental offices are correctly and well represented in the dental community, in the governmental legislative bodies. We want to make sure that we are represented correctly and accurately. So that's the advocacy part of the ADSO. What I do with the ADSO in terms of being curriculum chair is we help organize, our team organizes the yearly summit, which is coming up. And our focus on each summit is to bring in information that you are like cutting edge information, leading edge information about what the future is looking like for the dentists, for the shareholders, investors, every part of a dental office or a dental group or an investment group. So that's our goal with the summit, is to bring a lot of information and bring the latest information.
The ADSO Summit this year is in San Diego, and it's coming up in the middle of March, right? So we're not too far away. Any themes or trends that you think people can expect to see or hear about this year that kind of seem to be hot button issues?
We are going to be discussing the future of dentistry. We're going to be discussing what does a future of a dental group, a dental practice look like for it to sustainably grow and grow well year over year. We're trying to deliver the information that people can use for the next 10 years in keeping their dental offices or dental groups in a growth trajectory. So that's our big focus for this year.
Got it. And I mean, you've definitely shown and had a track record of growth over a very long time at this point with what you've done with Westwind integrated. And recently you decided to found another organization, which, because it's in a different region, you're going by Prime Health Dental, and that's in Wisconsin. Talk a little bit about the decision to do that.
Yeah, so we are a private group, right? The offices are owned by me and Dr. Nabil Fabi. We're partners, we're husband and wife, we're both dentists, and we started this group many, many years ago. And we started the group on the premise of we want to do good. We want to do good for the people that work with us, the people that come to us. We want to just do good for the community. We are in Phoenix, as you know. We have 14 offices in Phoenix, and we have lots of doctors, and we love our community there. We were ready to expand outside of Phoenix, and we have had a group before in the Midwest. We used to have a group in Michigan. So we're very familiar with the Midwestern environment. We chose Wisconsin because my daughter is in school in Wisconsin. She's in the dental school here. So we decided that, you know what, we're going to be spending a lot of time in Wisconsin. She's going to be spending a lot of time with Wisconsin. We want to grow outside of, the West, because Westwind in the West Coast is going to continue to grow. It's a very well-established legacy company, and it's going to continue to do what it does. And we're going to open a new platform. So we opened 3 offices here in Wisconsin, and this is going to be our Midwestern platform.
Oh, that's fantastic. When you open new offices, do you do a de novo model, or are you doing acquisitions?
Yes. Yes.
All the above?
I'll let you know. So we actually did 1 de novo and 2 acquisitions here. As you know, you've talked to many people. There are pros and cons of both. So we're working through that. We just opened them 2 weeks ago. So
do you have a favorite model yourself?
Honestly, no. It just depends what the region needs and what each environment needs. I've done maybe 50 acquisitions so far in my career, and we've done 12 de novos. So it just depends what we need and where we need it.
So your daughter is currently in dental school. So she's studying to become a dentist. Follow in mom and dad's footsteps. How did you originally find your way into dentistry?
I looked at my orthodontist when I was like 12 years old, and I was like, this job is for me. I really like what this dude is doing. I have honestly wanted to be a dentist since I was that young. I really liked what he did. I liked how he made me feel. And I thought it was a great profession. It was like, I can do this. I can visualize my life living like this. So I knew I wanted to be a dentist. When I went into my undergrad, I knew what I wanted to do from the beginning. I know, which is not the typical story, right? But I've known I've been wanting to do that.
Yeah, you've mentioned a few times, wanting to help people and wanting to help the community, and that's a driving force behind the business that you've grown and that you've built. When you think about that, what, from your perspective, creates a great patient care experience, and what do you teach your teams that are some of the necessary components in order to ensure that people feel as good as you felt when you were sitting in that chair of your orthodontist when you were 12 years old?
We just had this discussion here with my brand new regional manager. And whenever you do an acquisition, you take over another culture, right? So that's a transition period where you take the leaders of those offices and you transition them into your culture and into your beliefs and into your systems. So I just had this discussion with my regional manager here that she was part of the old culture. And I was discussing with her of how do we create a great environment? What does that mean? A great environment means that everyone wants to be there. The patient wants to be there. The team wants to be there. The doctors want to be there. And they want to be there, and they love the day for the day. So they walk in the door, they love the day, they love each other, and they leave, and it's done. So how do we create that environment? Through communication. We communicate positively with each other. So we try to create that environment, right, with the team members that we have. But you have to have that mindset, that the team member has to have that mindset that they want to show up to work. They want to show up to work and do good for each other, be 100% accountable, be responsible, and then go home and leave everything at work. So if you have that mindset, everything else is easy, because then they create that environment for each other. And then once they create it for each other, it's naturally created for the patient.
Love the day for the day is a really great way of framing that. It's maybe another way of thinking about, kind of being in the moment and, ensuring that you're focusing on what you can control and what's right in front of you right then, which is going to be the patients and your fellow team members. When somebody's not loving the day for the day, and you're having challenges, or somebody is not adapting to the new culture because they're part of the old, what are some of the approaches that you take to either determine that they're not going to be a good fit, or see if you can still help them to come around to the methods that you like to employ?
For us, or for me personally, it's the mindset. And I do a lot of our culture training with, the new groups and the new people, because I want to make sure that they understand where my mindset is. So if they have a mindset of growth and they have a mindset of positivity and they have the can-do mindset, then I can help them. If they have a block mindset and everything that comes out of their mouth is a reason why it can't be accomplished, it's very difficult to motivate and drive that team member. So, and at that point, we have hard conversations. This is the mindset that I'm looking for. This is the mindset I bring to the table. Are you able to match it? Or are you able to work towards it? Are you able to see it? Because if you can't match it, work towards it, or see it, then you're not going to be a fit for our organization. Whether it's today, tomorrow, or next week, it's not going to work for either party. So I expect them to show up with an open mind. I don't expect people to have great days every day, like great patients every patient. Absolutely not. We were given all these emotions for us to have emotions. It's okay for us to have emotions. It's not okay for us to be mean to each other, take it out on each other, blame and complain. That's not okay. You can have the emotions, but we need to channel it correctly.
What sort of career pathing do you seek to offer within your organization so that individuals that are ambitious or want to continue, their personal or professional growth, have kind of an opportunity to do that, either within your organization or with others? Is there any focus on mentorship or anything along those lines?
We have very clear goals and responsibilities for every position in our organization. And every position's goals is posted. So it's very transparent, clear. So if you want to go from a sterile tech to a secondary assistant, then to a lead assistant, then to a primary, like everything is completely there for you. You know what you have to do, and you have to be responsible for your growth, right? You have mentors throughout the organization. We have directors, we have regional managers, we have actually a group trainer, someone that goes into the office with the intention of training you to be the best in your position. That's her intention, is to make you successful. So you have all the tools, but it's up to you to seek them. Well, if you want to grow, we're here to help you. And if you're happy where you're at, we're here to support you. Not everyone needs to grow and change positions. People just love stability, and that's great.
Absolutely. When you think about kind of your own career path and continued desire for professional growth, where do you go to learn? Are there individuals that you talk to, or the books that you like, or anything just kind of in general?
This is a funny question. People ask me this question all the time. They're like, who are your mentors? Who do you go to learn? What do you learn? And the answer is always the same. I learn almost from every single person I meet. I seek to learn from individuals that are different from me. So as an example, on my free time, I'm a dancer. I love dancing, right? So
what kind of dance?
What kind of dance? I do dance team, jazz, and hip hop. So
very cool.
So I look at my dance teachers and I go, you guys are amazing. Like, I am going to continue to learn to get better in this particular thing that I want to get better at. And, the way they interact with each other is very different than the way I interact with my team members. And I learn from them, right? So there is so much learning that can happen that doesn't need to be in your own profession or in your own industry or in your own lane or in your own job title. You can learn from many different people that have many different professions in many different ways and apply it into your own career. So if you know what you're seeking, right, you will learn it, and you will learn it from everyone and everywhere. You can learn things on, YouTube and Instagram videos. Like, you don't need one person to learn things from.
I couldn't agree more. It's also why biographies are one of my kind of favorite types of books, just because when you learn about somebody else and their history and how they've approached things, no matter what industry or where they came from. It's fascinating. You find all sorts of things you can apply to your own. When you think about the industry in general right now, what are some of the things that you're most excited about with dentistry? Like what makes you bullish about dentistry in general? Why you would encourage your daughter to, become a dentist? What are the positives?
I feel like dentistry is at ground zero. It's almost like it's the best time to be in the profession because the profession has so much to learn and so much to grow. We have so much to learn and grow in terms of our digital capabilities, right? AI and things that are coming into our profession. It's going to make our clinical care even better, right? Even easier, even more predictable. But there's also so many opportunities in terms of the trajectory of where dentistry is going, dentistry and medicine, dentistry in group practice. It's like an endless sea of opportunities. And I feel like we're on the baseline. It's the best time to be in dentistry right now.
Yeah. And then on the other side, if you think about things that are challenging or difficult, that it would just be awesome if somebody could fix, or if it was different than the way it is today. What are some of those things that seem unnecessary challenges in the space?
I think right now we're at a transition point between bringing in AI, bringing in outsourcing, and everything around human labor. And I think our biggest challenge right now is around the transition of how people are viewing their profession, right? How the labor force is viewing job markets, and how AI is incorporating in there. I think this is really difficult to maneuver because some of the AI isn't advanced enough, but then we need them to be more advanced so that we can incorporate it because our human labor, we're having issues with these 5 categories. So I think that particular area of the profession, I think, is the most difficult in this day. In the next 5 years, it's going to get much more clear, much more easy.
I agree. I think it's a challenge to navigate right now, especially with so much innovation happening so quickly. There's so many different tools that do so many different things, and trying to determine the ones that will actually provide value to your practice or help your team is very, very difficult right now. And it's also hard to know what is actually true because there's a lot of hyperbole about what things do, but then the reality of how it works sometimes falls short.
That's 100% accurate. And that's one of the reasons that whenever we bring in something, it's into a department that I have full knowledge of. So even in billing, like there's a lot of different ways that we can outsource or have AI do some aspects of our billing department, RCM, right? But then you look and say, is bringing X going to eliminate a human? Is this going to take place of a human, or is it going to make the process efficient, more efficient? Is it going to make it more profitable? Is it going to make it more, how is this going to help? If it's not actually going to replace something or enhance something where it's a tangible result for us, then we don't bring it in because it's not ready to be brought in yet. Because every time you bring in a new system, unless you know a tangible result of what it's going to give you and how the benefits are going to be at the end, then you're almost like going into a blind alley and you can't feel your way. And there's too many people relying on you to make good decisions.
Yeah, testing yourself. Yeah, because I was going to say I think the other challenge is anyone selling any type of technology or building something new, whether it's software or whether it's something related to tools or devices or materials, there's always hey, this increases this by this, or this does this by this. And it's really hard to understand whether or not that is going to be the same outcome that you receive in your practice with your workflows and with how you operate. And so your general advice is if you can test something yourself first, that would be your preference.
Test something myself in 1 or 2 control practices. I never like to test it in one. I like to test it in multiple, just because there could be reasons, right, why it doesn't work in one versus. So I usually test it in a small sample size of practices where I can keep track of its success. And if it's gonna be successful, if we see the value in it, then we bring it through the rest of the organization.
Awesome. I want to be conscious of your time. I think we're right up against it. I really appreciate you carving out some time for us today. I think that the listeners are going to take away quite a bit from the conversation. Any last words or anything that we didn't cover that you wanted to discuss?
No, I mean, I appreciate you taking the time to do this with me. Next time we'll do it in person, and we'll have some fun around it in person. But yeah, I appreciate it.
Absolutely. Maybe you can teach me some dance moves next time.
Yeah. Well, I'll see you all at ADSO at the event.
There we go.
So I'm going to be in Boston too for Yankee. So
yeah, we'll definitely be at ADSO. I will be in St. Lucia during Yankee, taking our team to President's Club. So I'm trading tropical for whatever minus degrees that's going to be at that point in time.
Yeah, I think you might win there.
Yes, but see you in San Diego in March for sure.
Yeah, sounds great.
The Dental Economist Show is brought to you by Planet DDS, home of Dental OS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. And thank you for listening.